Is your child having trouble with concentration at school, daily tasks, or completing homework on time? Go.
Oh, this isn't working.
Does your child suffer from attention deficit hyperactive disorder, better known in the streets as ADHD?
Tillman, how's studying going?
Great. I'm almost done.
Good.
Well, now there's Concerta. Concerta is a Schedule II central nervous system stimulant with therapeutic use of decreasing motor restlessness and fatigue while increasing motor activity.
Hey Tillman, you want to play some video games?
No, I can't. I gotta get a jump on next week's homework.
Wow. In no time, your unique little bundle of joy will be turned into a cross-multiplication doing, PEMDAS order of operation knowing dynamo. Concerta is given orally and should be administered early in the mornings before breakfast. Do not crush or break extended release Concerta. However, instant release Concerta can be given in the mornings and crushed up into food for finicky children. Initial dosing of Concerta is 0.3 milligrams per kilogram of body weight per dose, with a usual 2.5 to 5 milligram dose given at lunch and breakfast. Usual maintenance dose is 0.5 to 1 milligram per kilogram per day, with a maximum of 2 milligrams per kilogram of body weight per day, or 60 milligrams if the child is under 50 kilograms of body weight, or 100 milligrams if the child is over 50 kilograms of body weight. Drug interactions include increased effects from MAOIs and other CNS stimulants. Concerta may inhibit metabolism of warfarin, anticonvulsants, and antidepressants. There are no known food interactions with Concerta. Concerta should not be taken within 14 days of administration of an MAOI. If your child suffers from marked anxiety, tension, motor tics, or if there's a family history of Tourette syndrome or glaucoma, your child should also not be on Concerta. Additional contradictions include severe hypertension, heart failure, arrhythmia, hyperthyroidism, recent myocardial infarction, or angina. Adverse effects include delayed weight gain patterns in children receiving prolonged administration of Concerta. Overdose may produce tachycardia, palpitations, arrhythmias, chest pain, psychotic episodes, seizures, and coma. Hypersensitivity reactions do occur rarely, so that's a plus. Children receiving Concerta should avoid tasks that require alertness or motor skill activity until the response to the drug has been established. Report any increase in seizures and take early in the morning to avoid any insomnia. Report anxiety, palpitations, fever, vomiting, or skin rash. Report new or worsened symptoms and avoid caffeine. And do not stop taking Concerta abruptly after prolonged use. Basic interventions include monitoring of blood pressure and the patient's pulse, while also evaluating changes of the patient's symptoms of ADHD. CBC differentials should be performed routinely during therapy. If paradoxical return of attention deficit occurs, dosage should be discontinued or reduced. You should also be monitoring the patient's growth patterns.
Thanks, Concerta.